PTSD, post-traumatic stress disorder, can trigger psychosis in some individuals, though this is not a universal experience. The connection between PTSD and psychosis is complex and influenced by various factors, such as the severity of trauma, personal vulnerability, and coexisting mental health condition. Here's a breakdown of how PTSD might lead to psychosis. PTSD symptoms overlap with psychosis. Certain PTSD symptoms can resemble psychosis or contribute to its onset. Intrusive memories and flashbacks. These may feel so vivid and disorienting that they resemble hallucinations. Hypervigilance and paranoia. Extreme alertness can cross into delusional thinking. Dissociation. Severe detachment from reality can mimic psychotic episodes. Trauma-related psychosis. Some people develop trauma-related psychosis where psychotic symptoms such as hallucinations or delusions arise directly from the traumatic event. For example, hallucinations may involve reliving voices or images from the trauma. Delusions may center around themes of persecution or danger. Risk factors for PTSD-triggered psychosis. Not everyone with PTSD develops psychosis. Likelihood increases with severe or prolonged trauma. Repeated abuse, combat exposure, or natural disasters can heighten vulnerability. Genetic predisposition. A family history of psychotic disorders can increase the risk. Substance abuse. Drugs like alcohol, cannabis, or stimulants can exacerbate symptoms. Pre-existing mental health conditions. Anxiety, depression, or a history of psychotic episodes increase susceptibility. Neurobiological stress responses. PTSD alters brain functions such as in the amygdala, hippocampus, and prefrontal cortex, which are linked to psychosis. PTSD and comorbid disorders. Sometimes psychotic symptoms occur due to overlapping or coexisting disorders. Schizoaffective disorder or schizophrenia. PTSD may exacerbate symptoms in people predisposed to these conditions. Bipolar disorder. Traumatic stress may trigger psychotic mania or depression. Dissociative disorders. Severe dissociation can present similarly to psychosis. Treatment and management. If PTSD leads to psychosis, a combination of treatments can help. Trauma-focused therapy. Techniques like EMDR, eye movement desensitization and reprocessing, or CBT, cognitive behavioral therapy, help process trauma. Antipsychotic medications used to manage psychotic symptoms. SSRIs or SNRIs, commonly prescribed for PTSD symptoms like depression and anxiety. Supportive care, peer support groups, mindfulness, and stress management techniques. Key takeaway. While PTSD and psychosis are distinct conditions, the overwhelming stress and neurobiological changes from trauma can sometimes result in psychotic symptoms. Early intervention and comprehensive treatment are crucial to improving outcomes. If someone exhibits signs of psychosis alongside PTSD, seeking professional help is essential.